Puberty might seem like it sneaks up out of nowhere, but it's actually a carefully orchestrated biological process that transforms a girl's body from childhood into adulthood. And believe it or not, it can start earlier than many parents expect, sometimes as early as age 8. So, how does a girl's body change during puberty? Let's explore the science. What is puberty? Puberty is the stage of life when your body begins producing special hormones, like estrogen and progesterone, that drive the development of adult physical characteristics. These hormones are released by the pituitary gland in your brain, which signals your ovaries to begin maturing. This entire process is part of what's known as the hypothalamic pituitary gonadal axis, a key hormonal pathway involved in reproductive development. When does puberty begin? According to the American Academy of Pediatrics, puberty in girls typically begins between ages 8 and 13, although it can vary widely. Genetics, nutrition, and overall health all play a role. It's important to remember, there is no perfect timeline. Everyone develops at their own pace. If a girl hasn't experienced her first period or menarche by age 17, it's a good idea to speak with a healthcare provider. This could indicate a condition known as delayed puberty, which might require medical evaluation. Physical changes in girls during puberty. Let's take a closer look at the most visible signs of puberty and why they happen. If you've ever wondered what's going on inside your body during these years, you're not alone. The changes are completely natural, and they're backed by biology. Physical growth. Why you suddenly feel taller. One of the earliest signs that puberty has begun is a growth spurt. Thanks to an increase in growth hormone and sex hormones, many girls experience a rapid increase in height, often gaining up to 3 inches per year at peak. But it's not just about getting taller. You might also notice wider hips, which help prepare the body for future childbirth. Weight gain around the thighs and buttocks, a normal part of female fat distribution regulated by estrogen. Changes in balance or coordination, as your body adjusts to its new proportions. Feeling clumsy. That's normal. Your brain is recalibrating your posture and movement to match your changing size. Breast development. What's really happening? Breast development, or thelarche, is often the first visible sign of puberty and begins due to rising estrogen levels. It starts with small, firm lumps under the nipples called breast buds. Here's what's important to know. One breast might grow faster than the other. This is completely normal. Nipples may change color, from pink to brown depending on skin tone. Occasional hair near the nipple may appear. Again, completely normal and harmless. Breasts vary widely in shape and size, and no two people develop exactly the same. Comparing yourself to others, friends, family, or celebrities, is not helpful. Your development is unique to you. You might feel tenderness or mild pain during growth, which is common. But if you experience persistent pain, noticeable lumps, or nipple discharge, talk to a doctor. If you're considering wearing a bra, ask a trusted adult. They can help you choose something comfortable and supportive for your stage of development. Body hair. What to expect? Another change is the appearance of body hair. You'll likely begin to notice hair growing in your armpits, in your pubic area near the vulva. This hair may start out soft and straight but typically becomes thicker and curlier with time. The hormone androgen plays a key role in this transformation. Whether or not to shave or remove body hair is a personal choice. If you're curious about it, ask an adult how to do it safely and hygienically. Skin changes. The truth about acne. During puberty, your body produces more sebum, an oily substance from glands in the skin. This can lead to acne, especially on the face, back, and chest. Here's what's happening. Hormone fluctuations stimulate the sebaceous glands, which can clog pores and cause pimples. What helps? Keep your skin clean but don't overwash, it can irritate the skin. Avoid popping pimples, as this can lead to scarring. If acne becomes severe or painful, see a healthcare provider. They can recommend treatments like benzoyl peroxide, salicylic acid, or prescription options. Remember, Acne is common and affects nearly 85% of teenagers at some point, according to the American Academy of Dermatology. As puberty progresses, the changes don't stop at just physical appearance. Hormonal shifts also influence your feelings, instincts, and body rhythms, including your sexual development and menstrual cycle. Sexual feelings. A natural part of puberty. As estrogen and other sex hormones increase, it's completely normal to start experiencing sexual feelings, including curiosity about your body or attraction toward others. This is part of psychosexual development, and it's completely natural. Some girls may feel the urge to touch or rub their genitals. This is known as masturbation, and from a scientific perspective, it's a common and normal behavior during adolescence. However, it's important to understand, this is a private activity. It should only be done in a private space, never in public. If you feel confused or uncomfortable about these changes, talking to a trusted adult or doctor can be helpful and reassuring. Menstruation. What to expect from your first period. One of the most significant milestones in puberty is menstruation, or getting your period. Here's what happens. Every month, the lining of your uterus thickens to prepare for a possible pregnancy. If no pregnancy occurs, the body sheds this lining through the vagina. That's what causes a period. On average, girls get their first period about 2 years after breast development begins. This varies, but it typically happens between the ages of 10 and 15. Is my period normal? Typical period. Lasts between 3 to 7 days. Occurs approximately once a month, though cycles can range from 21 to 35 days. Involves a total of about 2 to 4 tablespoons of blood. In the first 1 to 3 years, irregular periods are common. You might skip a month or experience cycles that vary in length. That's totally normal as your body is adjusting. The color of period blood can vary too, from bright red to deep brown, and that's not a cause for concern. If your periods last longer than 7 days, are very heavy, e.g., soaking through pads or tampons quickly, or stop for more than 3 months at a time, it's important to see a healthcare provider to rule out underlying conditions like polycystic ovary syndrome, PCOS, or thyroid issues. Period symptoms. What's normal? Having a period is a healthy and expected part of puberty, but it can bring some discomfort. PMS, premenstrual syndrome, mood swings, bloating, irritability, or cravings. Menstrual cramps, caused by the uterus contracting to shed its lining. If your period pain keeps you from going to school, socializing, or doing normal activities, talk to your doctor. There are safe treatments that can help you feel better, ranging from heat packs to medication. Body image and self-esteem. Puberty can affect how you feel about your appearance. As your body changes, it's normal to compare yourself to others, feel unsure or self-conscious, be influenced by media and social expectations. But there is no such thing as a perfect body. Everyone's journey is unique, and your shape, size, and pace of development are just right for you. Focus on wearing clothes that make you feel good, celebrating your strengths and interests, taking breaks from social media if it affects your self-esteem. If you're struggling with your body image, consider speaking with a doctor, therapist, or school counselor. Changing relationships. As you mature emotionally, your relationships may evolve. You might want more privacy from family, spend more time with friends, explore romantic feelings or not, and both are okay. Friendships might shift during this time too. Try to be understanding of others' emotions, and be patient with yourself. Puberty is a learning curve for everyone. Advice for parents. If you're a parent, your child may begin to pull away for independence. That's normal, but staying involved is still essential. Here's how you can support her. Start honest, age-appropriate conversations before puberty begins. Talk about period care, hygiene, mood changes, and sexual health. Help her track her cycle using a calendar or period app. Offer to shop for bras or period products together. If you feel unsure how to approach these talks, another trusted adult, like a doctor or family member, can be a helpful resource. Final thoughts. Understanding how a girl's body changes during puberty includes acknowledging your emotional, physical, and reproductive development. Puberty is a journey that unfolds differently for everyone. But every stage, from body changes to your first period, is a sign that your body is doing exactly what it's designed to do. You're growing into yourself, and that's something to feel proud of.